So the best advice is to be evaluated and allow a dermatologist to determine how often they need to be seen.
Mhm.
Some people need to be seen very frequently because most importantly, they may have a history of melanoma or a family history, or they may have had very heavy UV exposure in childhood or for some reason. Um, Other people may have a much lower risk and an annual exam is sufficient, um, or even just a good exam by their internist or a primary care doctor. So it's highly variable just again as skin pigmentation is highly variable and the risk of melanoma is highly variable across our population. However, melanoma, the very best therapy for melanoma is early detect well, the very best is prevention, of course, so that goes without saying. But early detection and removal, by catching a melanoma in its earliest stages is said to cure, probably 95, 98% of the time, simply removing it, end of story, nothing more to do. Overall, if you ask when patients are diagnosed with melanoma, some of whom are gonna have thicker melanomas or even advanced melanomas at the time of diagnosis. Overall, about the number we use is about 6 out of 7 newly diagnosed melanomas are curable just by removing it. So most melanomas are diagnosed on the skin relatively early. If you have a concern, get it checked out. Waiting, delaying is not a good idea because you want to catch this early. If you catch it early enough, remove it early enough, it's over and you caught it. And there's statistically very good evidence support for that approach.